Hello everyone, my name is Truong. I'm a licensed pharmacist in Arizona. Currently, I'm a PGY1 pharmacy resident, meaning a postgraduate year 1. It is an honor for me to be here talking to you about what you need to know about hepatitis C. During this presentation, I'll be using the term hepatitis C or Hep C for short interchangeably. What is hepatitis? What does that mean? So the term hepatitis came from Greek. If you break up the terms, hepatikos meaning liver, and itis at the end of the terminology, it means inflammation condition. So if you put the two together, it means an infection that attacks the liver and leads to inflammation. So we all know that each of us has a liver, but what does the liver do? So I'm going to talk about the function of the liver. So liver, what it does is it processes the nutrients, the food that we eat, and has also filtered the blood. So everything we eat, we drink, and also including medication, it will be filtered in the liver. Another function of the liver, which is very important to us, is to fight the infection. It's continuously fight the infection every time we have new bacteria or new viruses attack our body. I will be talking briefly about 5 different types of hepatitis, from A through E. Now, the alphabet order does not mean the severity of the condition. However, it stands for a certain type of virus. For example, now we talk about hepatitis A. Hepatitis A is a type of virus, once again, but this one is sometimes self-limiting, meaning your body will fight it off and does not result in a chronic infection. Hepatitis A is transmitted or transferred from one person to another through eating or drinking contaminated food or drink, or through spit or your stool also is another way. Hepatitis B is again another type of virus transmitted through sexual contact, sharing injection equipment, or through childbirth, meaning you transfer from one to another, from the mother to the child. Now, this Hep B virus can be short or long term. Hepatitis C, which will be discussed further during this presentation. Hepatitis D is one thing I would like to mention about hepatitis D is you have to be a patient with hepatitis B in order to get hepatitis D. And this type of infection can be either short-term or long-term. Now, the last one of type of hepatitis, which is E. E is kind of similar to hepatitis A as far as the transmissions or transfer from one to another. It can be transferred through food or drink. So how many people out there are infected with hepatitis C? How common is it? So according to the CDC, meaning the Center of Disease Control Center, reported back in 2010 that estimated there were 2.7 to 3.9 million people have hepatitis C. Among all of those estimated number, 17,000 people have been diagnosed with hepatitis C, and many people out there don't even know that they have it. With that number, around 12,000 deaths caused by hepatitis C each year. And so just to mention that many people out there are diagnosed with hepatitis C, but only 17,000 people got diagnosed. So many people out there got infected, but not knowing that they even have it. Now that I will focus on state specific, which is Arizona. On this graph, the x-axis or the horizontal bar will show the number of people got infected with hepatitis C. Now, starting from 2009 to 2015, you see an asterisk right above the number of the year. So meaning these are electronic lab report, meaning if the physicians or patients out there did not report that they have hepatitis C, the number were not included. So this whole number is not an inclusive list. On the Y or the vertical axis show the number of patients who got infected. So if you see the trends going up since 1998 to 2015, the number just keep going up and up. And we are now in 2018, so that number is now a lot bigger. So 2015, we got about 117,500 people got infected in Arizona alone. Now, I would like to narrow it down to county specific, which we are in, Mohave County. And this geographic diagram basically shows the number of people out there got infected. The color intensity will show if the county has more people. So this report was brought up in 2013 to 2015, so only that 3 years. And Mohave County, which I circle in yellow, has the darkest color, which we are in. So this will be a public concern to us that we are in the county that has the most number of people who got infected. So you will look briefly, the number rate per 100,000. So we got about 160 to 217 patients per 100,000 in our county got infected in 2013 to 2015. How do we know we get hepatitis C? Hepatitis C is a blood-borne disease, meaning it's transmit or transfer from one to another via infected blood. So basically, if person A has hepatitis C and somehow they got bleed, and that will be the way for it to transfer from one person to another. The most efficient route of transmission is through injection drug, which Mohave County has the highest among Arizona, which is about 60%. So this is a big threat to our population nowadays. And this is how we got such a high number in getting hepatitis C. Also, the second bullet on this slide is blood-borne disease spread through contaminated blood or other body fluid enter the bloodstreams. For example, if you work with someone and they use needles and share needle with other people, and a person who start using the needle who had infected with hepatitis C, that will be another way, which is very common for other person to get infected. On the other side of the coin, how does hepatitis C not spreading from one to another? Hepatitis C cannot spread from one to another via coughing or sneezing. For example, if you have a cold, you cough and sneeze, that cannot spread from one to another in hepatitis C. Holding someone's hand when there's no blood involved, that is also another way that you cannot catch. So hugging and kissing, for example, you have a child, if you have hepatitis C, and when you hug or kiss your baby, that would not be a way for it to spread from you to your child. Sharing eating utensil and drinking glasses also is another way that you cannot catch hepatitis C because there's no blood involved. With a brief discussion on hepatitis C and how it's got transmitted from one to another, how will we know if there's any vaccine out there to prevent this from happening? So currently, there is no approved hepatitis C vaccine in our country or any other country. Research is ongoing for future vaccine because of the lifestyle of this hepatitis virus is very complicated. As soon as we stop the process of transmitting from one to another, the virus will change that route of transferring. So right now, research is still ongoing to find if we have a vaccine or not. Since there's no vaccine, how do we prevent this from happening or catch the Hep C? What can you do to prevent Hep C infection? Do not use personal items that could be infected by another person's blood. Do not get tattoo or body piercing at an unlicensed facility because they are more than likely to use unsterilized equipment, and that is how you catch hepatitis C. Do not share or reuse needles or syringes. So for people at home, when they are, example is you are diabetic, you use your insulin, and now your relatives ran out of needles and they want to borrow or you share with them, also very commonly seen that this is the way that you will get hepatitis C. There are two types or two phases of hepatitis C, acute and chronic. Acute, your body will try to fight it off, then the infection will be removed from the system. However, if your body is unable to fight from the acute infection, that will lead to chronic condition. Chronic meaning long-term or after 6 months or longer than 6 months. And now long-term infections with hepatitis C, meaning you have the virus in your system. Usually this infection is considered as a silent infection, meaning you cannot feel it, you cannot see it, you cannot know that you have an infection unless you get diagnosed and get screened. This is the #1 cause of liver cancer and liver transplant, because when it gets to the chronic phase, your liver is pretty much damaged. What is the process after you got a chronic hepatitis C? So this diagram or picture show you the process and also the percent of catching from chronic hepatitis, go through cirrhosis, and then what's the chance for you to get end-stage liver disease and or liver cancer. So the very top one is when you have a normal, healthy liver, and then when you get infected with hep C, 55 to 85% of that will lead to chronic hepatitis C. And then from chronic hepatitis C, 20 to 30% chance that you will get cirrhosis, meaning when your tissue in your liver is damaged or dying. Now from cirrhosis, even though it's very small percent, but it's very, very dangerous, or by the time you get to this stage, it's very irreversible or cannot go backward to the previous phase of your liver. End-stage liver disease, 2 to 5% per year, and 1 to 4% per year of liver cancer. And in order for you to be a candidate for a liver transplant, it is not easy to get a new liver. And you have to meet a certain criteria in order to get liver cancer transplant. So far, we talked about what it is, how we prevent from happening, and also any type of vaccines possible out there. So now, how do we know we have the liver? These are common signs and symptoms of liver damage that many people don't pay attention. Again, like I said, hepatitis C usually goes unnoticed until virus damages the liver enough to cause signs and symptoms of the disease. For example, if you have dark urine, you think that it might not be related to the liver, but it is. It can be related to your liver condition. Gray color stool, also because the liver, once again, it processes nutrients and the food that we eat. So when the color of the stool changes, there's some abnormalities going on with your liver. Joint pain, once again, with people who have like arthritis, they think they just have a joint pain due to maybe the weather change or when you have a cold or flu. But with that condition, you might be having hepatitis C that you don't know. So when you experience these symptoms, please get screened or get checked out by your doctor. Yellow skin or eyes is a very common and very obvious for hepatitis C or any kind of hepatitis infection. Fever can also be experienced by the patient who have hepatitis C. Feeling tired, don't ignore that you feeling tired by the end of the day after work. Sometimes this can also be one of the signs or symptoms. Decreased appetite, because once again, the liver processes nutrient. So if the liver cannot function right, it would affect your appetite. Abdominal pain and nausea and vomiting is also the signs and symptoms. So once again, if you experience 2 or more of these symptoms, make sure you get it checked out or get screened by your primary care physicians as soon as possible. So do all of us have the same risk of catching hepatitis C, or who has a higher risk? Example will be explained. You are at risk of having hepatitis C if you were born between 1945 and 1965. And the reason for this was because of the medical equipment was not sterile like we're having now. Also, because of that is the baby boomer phase, and that's when we tend to share needles when people use injection medications. So between 1945 to 1965, so that means you're about between 60, 70 years old. So if you're in this time range of your age, make sure you get screened if you have those signs and symptoms, which I previously mentioned. Receive a blood transfusion or organ transplant before 1992. And the reason is the medical equipment was not as good as what we are having now, including people who are receiving blood clotting factors. For example, when they have some kind of factor deficiency and they bleed, they need clotting factor. So before 1987, the blood was not screened appropriately before it got used by the next patient. People who receive hemodialysis treatment for a long period of time can also be at risk of catching hepatitis C. Once again, because of the equipment, make sure that it's sterile and using the aseptic technique when they give hemodialysis. So who else is at risk for catching hepatitis C? People who have accidentally poked themselves with the infected needle, for example, healthcare workers or EMT, etc. So if a nurse working on the floor with a patient who is infected with hepatitis C and accidentally she just gave that patient the medication and then she poked herself with that same needle from the infected patient, she needs to be checked out whether she got the infection from hep C or not from that patient. People who were born to a woman with hepatitis C, the baby needs to be screened and checked out whether the mother transferred to the baby with the hepatitis C. Have had injected or inhaled illicit drugs. Once again, I cannot emphasize enough, this is a very commonly seen pathway for the condition to go from one to another, very common. Had sex with someone who infected with hepatitis C, like I previously mentioned on my second or third slide, that this infection is transmitted or go from one to another via sexual contact and blood-borne. Receive a piercing or tattoo in an unclean environment. As I briefly mentioned, the unclean environment tend to use unsterilized equipment. And that's, once again, if the previous person who got tattooed before you got hep C, you will have more than likely to catch hep C from that. Ever in prison? So studies show that at least 16 to 41% of prisoners have hep C. And then, so when they have, so this is the environment where people pass on from one to another easily if they have any kind of blood in the area, and then the next person comes in, then they get infected once again. So these are very common people who are at risk of catching hep C. Now let's talk about screening for hepatitis C. People at risk should be screened many times that I mentioned earlier. If you were born in that baby boomer time, and if you use medications, injectable medication that share needle with other people, and also if you experience any of those signs and symptoms that I previously discussed, strongly recommend to be screened for hepatitis C. So how do they do that? Basically, as a simple blood test that check for hepatitis C virus antibody. My abbreviation here is HCV, stand for hepatitis C viral infection. And then these tests are very much nowadays is affordable, and most of the time it's covered by your insurance. And the accuracy of these tests, let's say if you get tested and if you got negative, then no further testing or action are required. So what if you get checked and your blood shows that you have some kind of hepatitis C virus load in there? Now, that will indicate that the virus have transferred from the previous person to you. So now what else do they have to do? So they had to check what they call is the RNA is a type of DNA of the virus. So if they check that and they found you have HCV RNA, then you are detected with hepatitis C. And if they don't see that, no further testing or medications are needed in this case. Besides that, we also have a good news about hepatitis C. With all of those, even though it's without vaccine, but we do have a good news, and it's totally curable. It can be up to 100%, depends on what medications you're on and how compliant you are, and also the drug-drug interactions when you take hepatitis C medication with others. So again, recent advances in treatment use direct-acting antiviral medications. It can last up to 8 to 12 weeks for oral therapy. It can be longer, depends on the genotype, meaning the type of gene of the virus that you caught from the hepatitis C infection. Then the doctor will tell you the length of therapy between 8 to 12 or longer. Affordable, covered by insurance. Nowadays, the medications, in the past, it used to be individual medications and you take it 4 or 5 times a day, but now the pills are combined, which I will mention on the next few slides. Also, fewer side effects because the medications are also combined, and that will reduce side effects, but also better for the patient who take these medication. Again, I cannot emphasize enough, this is a curable infection at over 90%, and it can be higher than 90% if we treat it on time with the right medication and you are compliant with the medication that you take. With a high percent of cure rate, which I just mentioned, what are the goal of the treatments of Hep C? The goal is eliminate all Hep C virus in your body, and that is the optimal goal. Once the viral load is gone, hepatitis C is considered cured, meaning you are free. Your liver is clean again with no viral in your system. Improve your liver health. So after you receive the treatment, the next step is keep your liver healthy. Slow the progression of any liver disease, and therefore that will lead to reduction of risk of cancer. Let's dive into some common medications that we see nowadays in the market for treating hepatitis C. On the left column, I put is the drug classes of the medication, and on the right column are the name of the medication. The one inside the parentheses are the brand name. The one start out with the lowercase, lettercase, the generic. Why do we have these different groups of medications or classes? The reason, once again, is hepatitis C is a very complicated virus, and therefore, if we attack the life cycle of these viruses at a different replication cycle, then we will be able to get rid of or treat the condition. So start out with the top one is Prevnar, is one of the protease inhibitor, meaning is inhibit the enzyme making process of the virus life cycle. Second one is end with ASVIR. Also, this will inhibit the replication of a part of the life cycle of the virus C. The third one is BUVIR, that's the ending of the medication. Again, as an inhibitor or stop the replication cycle of that virus. Interferon and nucleoside is another group of medications in treating Hep C. Combined medication, once again, like I mentioned briefly, is in the past you have to take these medications individually, which was a huge load, and also that decreased the compliance. Patient did not want to take many pills a day. So now, with the advance in the medical field, these medications are now combined to one pill that will increase your compliance and also decrease the side effects, as I touched on earlier. what are we hopeful for in the future? So in the future, we hope that these medications, once again, it will become easier to take, like once a day instead of twice a day, and also a short length of treatment, because patients who take these medications will experience side effects. And these side effects sometimes be a factor why patient withdrew from the regimen, and the Hep C infection cannot be cured. Less resistance, meaning the medication's effectiveness is getting better. Again, these medications can also cause drug-drug interactions with other medications, and also the cost of the medication can be outrageous, can be costly, but that's the hope that the medication will become cheaper, or the generic will be coming out. And a point of care, meaning they have some kind of equipment for you to purchase and take it home and test it yourself or among your relatives. I'm aware that there are a lot of information about hepatitis C that I just went over. However, this slide will summarize the essential point that I just talked about. So hepatitis C is the most common blood-borne infection in the United States. Number two, about 50% are unaware of their infection, and this can be very dangerous, that you carry on with your disease and then you spread it on to somebody else, or your liver will be getting worse, or you might even get liver cancer or liver failure. Number three, the earlier the Hep C can be diagnosed and treated, the less your risk of having serious liver damage or liver cancer. Screening for hepatitis C basically just involves a simple blood test. Basically, your provider will just draw your blood and test to see if you have any kind of viral load in your blood. If so, the next step is they're going to test for the type of a gene of virus and determine the length of your treatment. Last but not least is treatment of hepatitis C is very effective. Once again, it's over 90% of patients are cured from this infection. So yes, the answer is yes, the disease can be cured and you can have a healthy liver again. With this slide, I would hope that you have some take-home messages regarding hepatitis C infection. Number one, and which is the most important, is avoid using items that could be contaminated with other person's blood. That means if you know any source of unsterilized equipment or tool that could have been used by somebody else that has blood on it, do not use it. Number two is never share or reuse syringe or needles. In that case, let's say you are diabetic at home and you are using insulin needles and syringes. And if your relatives ran out of needles and would like to borrow yours, the one that you have used, do not share or reuse those. Practice safe sex with your partner, meaning always use protection during sexual intercourse. Last but not least, talk to your healthcare provider, including doctors, pharmacists, nurses, about screening for your hepatitis C. So once again, my name is Truong, and thank you very much for watching and listening to my hepatitis C presentation. Have a great day.